Changes in women's health could be coming to 13 states across the U.S. A proposal by the Department of Health and Human Services could prevent states from blocking federal dollars to abortion providers like Planned Parenthood. But the move has over 100 lawmakers fighting back. And Local 8 News Washington D.C. correspondent Kelly Meyer has more. Hi, Kelly.
That's right. I talked with Congresswoman Diane Black, who says this could take away Tennessee's right to decide which women's health care providers get the funding. She calls it a federal overreach, while one pro-choice group says it could be a game changer for women's health care.
We feel that that is really a trampling of our states' rights.
Congresswoman Diane Black fighting back against the Obama administration. She says her state of Tennessee would be affected by a proposed rule by the Department of Health and Human Services. It would prevent states from blocking Title X funding, federal dollars for family planning services. 90 members of the House and nearly 20 members of the Senate signed this letter asking the HHS secretary to reconsider the rule. Iowa Senator Joni Ernst is leading the fight in the Senate.
We just want to make sure that there is an honest and fair assessment that's done across the board when it comes to Title X.
Ernst and Black argue there are plenty of other providers besides abortion clinics that could help give comprehensive health care, but one pro-choice group says this could actually help more women.
I think this ruling actually clarifies that clinics cannot be subject to ideological whims. Women suffer, families suffer, they don't get prenatal services, they don't get cancer screenings, and it's a public health disaster, and this rule will actually make sure that doesn't happen.
Hogue says the lawmakers who are trying to block the rule are on the wrong side of public health. But Black and Ernst say they're seeing a flood of people who don't want to see it move forward. Reporting in Washington, I'm Kelly Meyer. And Congressman Black tells us she's going to return and fight for this issue when she returns here to Capitol Hill just after elections. And other Tennessee lawmakers are signing on, like Congressman Fleischman. Now, this rule was proposed in September, early September. They had a month for public comment, and hopefully they say, when we talk to the Department of Health and Human Services, that they will have a ruling soon. Reporting in Washington, I'm Kelly Meyer, Local 8 News.